Hello, everyone, and welcome to this week's edition of Ask the Expert. My name is Ashley Baldwin from the Communications Department at the Pan American Health Organization here in Washington, D.C. And this week, we're going to be talking about vaccination in the context of COVID-19. So I'm joined by two of my colleagues from PAHO, Alba Maria Ropero, Regional Advisor on Vaccination. Hello, Alba Maria.
Hi, Ashley.
And also Dr. Ana Elena Cherez, Regional Advisor on Vaccination. Hello, Dr. Ana Elena.
Hi, Ashley. Thank you for having us.
Thank you. So yesterday, the World Health Organization and UNICEF warned that all over the world, the number of children that have received their vaccinations has reduced, and that this is due to interruptions in the availability and use of immunization services due to the COVID-19 pandemic. So it's having a very real impact on numbers on a global level, not just in the Americas. And I wondered if you could tell me a little bit about the current status of immunization and vaccination services in our region.
Thank you, Ashley. Thank you for inviting us here today to talk about immunization. As you already know, vaccination is one of the most cost-effective tools in public health, measures in public health. The Americas region has eliminated diseases such as polio, measles, rubella, and neonatal tetanus, and also is a leader for introduction of new vaccines such as HPV, Rota, pneumo, and influenza. This is the result of many efforts in the region. We have countries with a lot of commitment, the Ministry of Health leadership, but especially the commitment of healthcare workers and community engagement. Now, to maintain this vaccination coverage, you need high uptake of the vaccine. Now, with this pandemic, we have seen a decline on the uptake of the vaccines, and this poses a risk of all achievements that we have in the region. And we have been working with countries in order to support them to see how can we address these gaps on vaccination. But this is a very worrisome situation that we have not only in this region, it's worldwide, that we have seen a decline on vaccination coverage due to the shutdown of countries and also the overwhelming health services. And then there is a decrease, an important decrease on vaccine uptake.
So we're seeing that this isn't just a global problem, but it's also very much impacting us in the region of the Americas too.
Yeah. Go ahead.
No, go ahead, Alba Maria. Go ahead.
Yeah, it's important to take into consideration that we have many achievements in the region, but we have also challenges to maintain high coverage. For example, until 2019, we have a decrease in vaccination coverage with the Dpt vaccine. That means that around 2 million children in PAHO region has incomplete or not been vaccinated against these vaccines. And then we had a baseline that is worrisome because it's a decline in that coverage. Now the situation is getting worse because we have this pandemic affecting the uptake of the services, of the immunization services, and then we are at more risk for outbreaks of vaccine preventable diseases, or we can lose the status of free of diseases that we already eliminated.
I would like to add something. Immediately after the declaration of the pandemic, all countries started to contact PAHO and the immunization unit asking what were our recommendations. And in fact, that's why PAHO have published several guidance on how to implement, because there are changes, we have to adapt the program and the service to the circumstances we all are living now. But the fact that they were already looking and saying, we are not going to stop, we have to continue, show the leadership that Alba Maria mentioned. So it is not going to, this is not the first time that the Americas is implementing the program, the immunization program, routine immunization, as well as supplemental immunization activities under difficult circumstances. So we have hope that, yes, although there has been a important reduction in the coverage, and it's going to be impacted in the next months, but our country had the leadership and the capacity to improve coverage.
Thank you very much for clarifying, Anna. So just to go over something that Alba Maria mentioned. So she mentioned the DPT vaccine. So I think it's important to mention for our audiences that maybe don't work in the healthcare sector that this is the vaccination that we use as an indicator of vaccination uptake in the region of the Americas, but globally as well. Is that correct?
In fact, DPT-3, that is the dose given at 6 months globally, that protects against diphtheria, pertussis, and tetanus. It is the key indicator that is being evaluated everywhere, so we can compare different countries, and even not only country, but also going down to the local level, district, communities, to see what is the quality of the program, what is the quality of the coverage, and how protected children are.
Brilliant, thank you. So one of the aims of these Ask the Expert webinars is to take questions from the audience. So we'll invite anyone that has a question about vaccination in the context of COVID-19 to pop it into the comments section below, and we'll get to it as soon as we possibly can. But before we have a look and see if we have any questions, I just have a few more things to ask you. Anna, you were talking about the recommendations that PAHO has when it comes to maintaining vaccination programs within a pandemic scenario. What exactly are those recommendations?
Well, as we were seeing that different guidance were written on how to conduct the immunization program, the routine immunization program under the context of the pandemic. And that's went from, includes from aspects related with what vaccines to prioritize, when can we implement, when we cannot implement, in which vaccines should be prioritized. And I would like to Alba Maria to add something on influenza, because it's amazing the progress that has been done during the pandemic regarding vaccination of influenza. In fact, that is an example that other regions can learn from countries from the Americas.
Yeah, thank you, Anna. It's a pleasure to share with you this beautiful experience that happens in countries right now, because there are 14 countries vaccinating against influenza in the southern corner of the America. That means that they are vaccinating against people against flu, people with chronic conditions, people, pregnant women, healthcare workers, and also the elderly. But the most important part that Ana Elena mentioned is how they can reach these people without the risk of transmitting COVID. That is the question. And then how countries manage that situation. They adapted the services based on the context of COVID. They adapted the service, and then they separated, for example, the vaccination of the elderly, and they set up vaccination posts in empty schools because they are closed because the quarantine. That was beautiful. And also driving through vaccination in cars. And that way people don't have to go to the health services. They receive the vaccine in their car. The risk is minimal. And the healthcare workers are using the equipment for protection in order to avoid the transmission, and also to protect the community and protect the healthcare workers. Other practices, nice practices, for example, some countries have the practice of the elderly going to the banks to claim the pensions, and they install post-vaccination in those banks in order to reach those populations. You see, there is a lot of creativity in the countries, and we are sharing these experiences with other regions, and they are amazed because at this moment, in these conditions, in the middle of the pandemic, they have vaccinated more than 87 million people. And the goal established was around 100 million people. That means that they have been vaccinated a lot of people in a very short time in the middle of a pandemic. And then this experience will be applied also when we have the COVID vaccine, because we are learning how to deal with these activities in the middle of a pandemic.
And is this the influenza vaccine specifically, or is this sort of vaccines across the board?
This is influenza vaccine because countries were approaching to the season. The southern corn faces the season of influenza between March and June, and they have to vaccinate before the peak of influenza. And that means that they were worried also that they had another respiratory disease circulating. And then in order to avoid the circulation of both viruses, the influenza and also the COVID, they were able to have the vaccine campaigns earlier than the previous year in order to avoid these two circulations. This is very important because even though the flu vaccine doesn't protect against flu, but you are able to protect them against flu and then don't have to go to the health services, to the hospitals. And then you are able to free up the health services to be dedicated to COVID patients. And then you have different benefits with this vaccination.
Okay. So, sorry, Anna, I was going to cut you off.
Oh, sorry, I just want to add that at the same time, we have that example because the COVID situation, there were 8 countries that have to postpone their campaign for measles for next year, probably. So this is affecting at the same time. Yes, we are having, as Alba Maria was saying, excellent example of a vaccination against influenza, but at the same time, the situation has made us and have made this country to take the decision to postpone important immunization campaigns as measles. But we hope that soon they will be able, and with the lesson learned from the influenza vaccination, this country will be able to go back and plan and finalize the planning and organization, and of course, the implementation of the measles campaign that it was targeting close to 100 million children. So these are very important campaigns that we hope that it will resume soon.
Brilliant. So we've spoken a bit about, these great examples of countries that are continuing immunization programs for influenza, which of course, when we're in the midst of a global pandemic of one respiratory illness, is hugely important. And you also mentioned, Alba Maria, the countries that have implemented vaccination posts when certain at-risk groups, so elderly populations, go to collect their pensions, which is of course very important as well. But what about some of the other at-risk groups? So we talk a lot about vaccination programs in the context of newborns and their mothers and pregnant women, which is usually a priority group when it comes to vaccination. So what vaccinations do we recommend for these groups specifically, and how can we continue to ensure that mums and babies are vaccinated during COVID-19?
Yeah, that is important because in middle of this restriction of the health services, maternal health services have been affected as well. And then the reduction of vaccination coverage in vaccination in pregnant women has seen. That is critical for influenza. Pregnant women are one of the risk groups, and then that group is considered during the campaigns. But other vaccines also have been administered based on the schedule of the country. And also with the newborn, as most deliveries are at hospitals, this vaccination in children born in hospitals should be a priority because they are already in the health services and then they have to be protected before the discharge. Of course, if we have a proportion of children born at home, services should be scheduled some strategies in order to reach them. But you have more than 95% of children born at hospital level. And then that is a huge opportunity to vaccinate the newborn against hepatitis B and also against BCG.
Also talking about routine immunization, using their immunization schedule, each country is targeting different groups. For example, some are immunizing against pertussis, pregnant women. And if there is no continuation or there are interruption of the service, of course, they are going to be at risk. That's why we are so proud that although there is a reduction in the coverage, efforts are being made to make sure that the service continues to be provided as recommended by WHO and by PAHO, because it's an essential service that has to be continued even during the context of the pandemic.
Brilliant. So we've spoken a little bit about routine vaccinations and the need to make sure that those continue throughout the pandemic, particularly for at-risk groups. We spoke about older adults, we spoke about mothers and newborn babies as being particularly important as a target for immunization programs. But let's talk a little bit about the COVID-19 vaccine, which I can see from the comments we're starting to get a few questions about. Could you tell us a little bit about whether a vaccine has been developed against COVID-19, and if not, what stage of development are we currently in?
Yeah, there is not a vaccine available yet, but there are global efforts in order to develop vaccines. This has been an amazing run in order to have vaccines available, vaccines which needs to be safe and effective. And then at this moment, we have more than 160 vaccines, which in process, in research. Of those, 23 are in clinical trials in humans. That is important step in order to have vaccine very soon. But I would like to highlight here that developing a vaccine could take years of research. In this moment, as we have a global coordination strategy in order to have vaccines for people, and especially trying to find vaccines, having vaccines that which are accessible to everybody in order to reduce inequities in vaccination. And then that is one of the key part of the global alliance in order to support the development of these vaccines and having a new different prospective vaccines in order to vaccinate different groups at risk for COVID, at least for now.
So it's going tremendously fast compared to really vaccine development.
You have seen years, and now we are talking about months, and having now at this moment clinical trials in the field that is really fast in order to have the vaccine. We expect that we'll have a vaccine maybe at the end of this year or at the beginning of the 2021. But that means that they have to be produced. One thing is to having the vaccine developed. The other one is to produce the vaccine in a huge and big amounts in order to vaccinate the population. And we are expecting to vaccinate at least, if we are talking about the ideal situation will be, we expect to have vaccines for everybody, for 7 billion people, but that wouldn't be the case. And then we have to accept that the beginning will have millions of doses, but we have to be prioritized to the high-risk groups for COVID-19.
Yeah, this is what I wanted to ask. So let's assume that one of these, I think you mentioned 23 vaccines that's currently under human trials, is effective and doesn't have, too many side effects, etc. And that's ready by the end of the year. I'm assuming that the vast majority of manufacturers aren't then going to be able to immediately roll out 7 billion doses. So do we think that everyone should receive the COVID-19 vaccine? Will it be available for everyone? And how should we prioritize who gets it first?
Yeah, ideally, as I mentioned, should be for everybody. That is the ideal situation. But we expect, and the global estimation is to have 2 billion doses at the end of 2021, 2 billion doses. That means that as we don't have for everybody, we have to prioritize. And who are the people who be vaccinated first? First of all, the healthcare workers. You need to have the systems working and attending cases and also functioning the health system. That is one key priority, the healthcare workers. You have seen that this is one of the groups more affected, and we have lost a lot of lives from our colleagues in different hospitals. And that is a key group. The other group that is very much affected is the elderly with the high mortality and also people with chronic diseases. And then the global estimation is, there is a global structure in order to negotiate and also to distribute the vaccine in a very equitable way. And then it's estimated that at least at the beginning, all countries receive vaccine for 20% of that population, which is at risk. Those three groups that I already mentioned.
Brilliant. And you also mentioned, vaccine development usually takes years, and we are so much more advanced. There's been such an urgency to produce a vaccine that we're so much more advanced in vaccine development with the COVID-19 vaccine than we would have been for vaccines against other diseases. But given that we've done it so quickly, could it be argued that maybe the vaccine might not be as safe as some of these vaccines that have taken years to develop?
That is a critical question, Ashley. I would say that all the steps to guarantee safe vaccine and efficacious vaccine has been maintained as a critical component of the development of the vaccine. That is not sacrificed. The part that this will be accelerated is the production part. For example, some manufacturers are testing the vaccine and they are seeing good results so far. And then the industry has been starting to produce already vaccines in a huge amount of vaccines, the production process. That is a risk that they are taking, because if the vaccine at the end doesn't work, they are gonna lose that money. But if the vaccine works, we will gain a lot of time and we'll have a vaccine soon. And then no, it's not a sacrifice. We are not sacrificing the safety and the efficacy of the vaccine. It's other risks that the manufacturers and the global community is taking into consideration.
Right, so it's meeting the same safety standards as anything else.
Yeah.
Okay.
Actually, at the same time, PAHO is following up on the development of the vaccines against COVID. We're also developing guidance on how to prepare the plan, how countries can best be prepared by the time the vaccines is ready. This includes in terms of, since you were talking about safety, to strengthen their system to make the surveillance of adverse events. This also includes to increase their cold chain capacity. They have to make an evaluation of how is the cold chain capacity. Do they need to increase their cold chain capacity? Ideally, to have a very strong reporting system that on daily basis, on a weekly basis, they can know exactly how many people were vaccinated, so they can make the redistribution of the vaccine locally where it's most needed. So you can see that there is a comprehensive approach of preparation for the introduction of the COVID or the potential COVID vaccine. And of course, we are talking and reviewing data of this, which group should be prioritized. And we know that soon there is going to be a presentation in the PAHO in the BD conference on what are the risks, what are the comorbidities that should be considered in preparation for, and this is important information that we are going to be using and decision making for which group has to be prioritized. But Alba Maria was talking about phasing, because it's not going to be all at once available, the vaccine. So this is, we will need solidarity, yes. We will need evidence to take decision about evidence. We will need to educate the communities. They need to know that it's not going to be all at once available, the vaccine, but at the same time, all what we have learned about social distancing, hand washing, and the use of masks, we have to continue doing that, because as Alba Maria mentioned it, the vaccine is not going to be available to all at the same time.
Right. We've had a question come in from Lucio Rubini, and he sent it in Spanish, so I'm going to do a very quick translation. So I guess this is related as well to a lot of the issues that we experience with the influenza vaccine, in that the vaccine has to be updated, correct me if I'm wrong, every year to make sure that it's optimized against whatever particular strain is circulating. Now, when it comes to the SARS-CoV-2 virus, do we know whether that's going to be the same? You know, is the virus mutating, and will a vaccine that's developed by the end of the year, for example, still be effective in, you know, another 18 months or another 2 years? Do we have that information yet?
That is a very good question, but we don't have that information yet. We know for influenza that we have to update the vaccine every year because influenza vaccine viruses are mutating, and then we have to update the vaccine to the new viruses in order to have the response to the new ones. We don't know yet with this COVID vaccine viruses how the situation will be. We hope not, but if not, we have to vaccinate every year. That is an additional burden for health services and for the community and for everybody. Because with the flu, you know that we have to be vaccinated every year in order to be protected with the new season of influenza. But that is the situation. As we have to observe and see the evolution of all of these situations and see how can we adapt recommendations and everything based on the new evidence. And related to that, one of the key components of the recommendations, we have the strategic group in WHO, is called SAGE. It's an advisory group for vaccination that will meet in October in order to evaluate the evidence and the situation and the high-risk groups and the development of vaccines and see what will be at least the first recommendations. And our regional TAC, which is the Regional Technical Advisory Group, will also adapt this recommendation for our countries. And that happens as well at national level because countries have scientific societies participating in these national immunization advisory groups to the Ministry of Health. That is a very critical and important component body in order to support the vaccination, the high-risk groups, and it's based on evidence, and they are the ones who are recommending and advising to the Ministry of Health in general.
So that was a great question from Lucio. And if anyone else has any questions whatsoever to do with vaccination, either routine vaccination programs in the context of the COVID-19 pandemic, or questions to do with a potential COVID-19 vaccine itself, please don't hesitate to put them in the comments section and we'll get to them as soon as they can. So your answer to Lucio's question, Alba Maria, brings me on to my next question, which is sort of related to some of the things that Ana Elena was saying as well about hand washing and the need to make sure that we continue those those basic public health measures, because even when a vaccine is developed and rolled out, it will not get to everyone at the same time. Can we assume that a COVID-19 vaccine will cure us of this disease? Will it be like some of the other diseases that we've eliminated in our region? Can we just get on with our lives as soon as we have the vaccine, like we were living 8 months ago, a year ago?
This is a very important question, Ashley, because we need to see the vaccine as a part of a package for prevention of the disease, not as a cure of the vaccine. And we have to learn, in addition to that, we have to have treatments, and we have to advance in new measures and learning about the process. But the most important part is that the vaccine, only the vaccine is not a cure. And also, if I am vaccinated, maybe I don't respond the same way that other person does to the vaccine, and it's not the same protection for me. If I vaccinate the elderly, maybe the protection is lower than mine. And then there are many questions and many aspects that we need to consider in this process. And then I would like to highlight that point because Ana Elena was highlighting that because it's very important that we need to maintain the non-pharmaceutical measures in place. In addition with the vaccination, and in addition with people which is getting sick, that will have some kind of protection, and then we'll see how we evolve. But don't see the vaccine as a panacea of the solution of everything, because it's not. We have to combine many measures in order to advance in the control of this pandemic.
I would like to add to Lucio Robini that Alba Maria mentioned these advisory bodies. And at the same time, here at the region, for close to 30 years, we have an advisory group that is supporting PAHO on decision making about which policy is or which vaccine is going to be recommended for our countries. So just to ensure, Lucio, there is a lot of discussion behind this. There is a lot of experts discussing what are the best recommendations for our countries.
Another question that I had, and thank you both Alba Maria and Ana Elena for responding so extensively to Lucio's question and to the questions that I think a lot of us have, me included. The region of the Americas, we know, is one of the regions, if not the region, with the most inequality in the world. When we have a vaccine, how are we going to ensure that it is accessible to all? We have higher income countries, we have very low income countries. How is it going to be a case of the higher income countries get there first? How are we going to ensure that it's equitably distributed throughout our region to these groups that you mentioned that need it the most?
We have here in the region a unique mechanism, which is the revolving fund, where countries have been able to buy vaccines to the population. That is a mechanism which guarantees us to have equity distribution to all countries in the region. And inside the country, I would like to say that vaccine is an equalizer. And the vaccine inside each country, they distribute the vaccine to everybody. For example, there are very nice programs for indigenous communities that they have a specific and very robust vaccination in those groups and their people with chronic disease or other groups that they need to have to reach, they will do that. But the most important part here, maybe I would say that the mechanism that we have for access to vaccines exists in PAHO region, which is the revolving fund. And then the vaccine will be distributed to every country in the region.
So it's not just a case of, I have a great health insurance plan, I have more money in my pocket, therefore I'm going to be head of the queue when it comes to getting this vaccine.
No, in the region, immunization is considered as a public good, which means that all governments invest in the vaccines for everybody in the public sector. They offer the vaccine free of charge. It wouldn't be, they don't have to pay for that vaccine. That is in all Latin American countries, that is the situation. And then the access will be for everybody.
Because I guess the more people that are vaccinated, the better for everybody.
The better we'll see for the control of the.
Actually, about what Alba Maria was mentioning about the revolving fund, because there is a structure already within in the region that is being used for many years. So this is not something new for the manager of the immunization program in each country. So they are used to, they know the processes, they know the tools that are normally being used by the revolving fund. While in other regions where there is no such a fund as the revolving fund, this is something new. And they have to restart and see how are they going to manage. While we have that enormous advantage that is going to make sure they help to deliver vaccine everywhere in the region.
So we've spoken about sorry to interrupt, Alba Maria. We've spoken about the revolving fund, but for those of us who aren't familiar at all with the revolving fund, would you mind just explaining a little bit about exactly what it is? Yeah, and what the advantages are of joining?
Yeah, that is a pool procurement mechanism that PAHO as a headquarters office buy vaccines on behalf of all countries. It's a collective purchase, and the revolving fund can negotiate prices, very low prices, and also guaranteeing the quality of the vaccines. And then that means that all countries have a very good vaccines, a very low price, independent of the status of the countries. All of them receive the same price and access to vaccines. But I would like to add to the revolving fund, because we had the experience with H1N1 pandemic in 2009. And then there was something similar that like we are living now with a lot of uncertainties with the vaccination and negotiations and global level and different levels. And then the PAHO revolving fund was able to negotiate on behalf of 24 countries in the region. And then they were able to receive vaccine even before other vaccine from WHO and other sources came to PAHO region. That was very important because especially small countries, they are not able to negotiate as a one country or two countries. And then this is a pool procurement mechanism which will have the same function now. The PAHO's revolving fund is participating at global level in these negotiations with the different actors in the world in order to have access to vaccine for our region.
So this ensures that particularly, I mean, all countries, but particularly smaller countries have more negotiating power when it comes to obtaining a vaccine, that it's cheaper, and that safety standards and things like that are also guaranteed. Is that correct?
That's correct, yeah.
So if, again, assuming that we have a vaccine developed by the end of the year, not necessarily rolled out, and we have, I think you mentioned, Alba Maria, that there's 23 laboratories that are currently on the human testing stage. Mm-hmm. So let's assume that one of those laboratories discovers the vaccine first. How will it work? Will that laboratory have the capacity to be able to produce it, you know, for the 20% of the world's population that are going to need it first, and then go on to produce it for everyone? Will other laboratories be able to help? How does that work?
Yeah, you know, one manufacturer wouldn't be able to produce the vaccine for all billions of people that we need to have in place. And then that means that this is an extraordinary alliance that we have globally. They are joining efforts in order to produce. They have transfer of technology for some countries to produce, to finish the vaccine. They can join efforts, for example, developing one component of the vaccine, others develop another component. And then this wouldn't be for one laboratory to produce vaccine for everybody. It needs to be a collaborative effort. And this is the first time that you see this. The vaccine is also managed as a public good, a global level, because otherwise we wouldn't be able to control or to advance in the control of this pandemic. And then that is a beautiful commitment and global effort that we are seeing at this moment and worldwide.
And I guess that brings it back to, you know, the way that Latin American countries see vaccination as this is a public good, and having a COVID-19 vaccine isn't just going to benefit one country, but it's going to, you know, hopefully open up international travel. We'll all be able to visit our families again, et cetera, et cetera. So we really need to work together when it comes to, once the vaccine has been developed, to produce it and to get it rolled out on a global scale. How much will the vaccine cost? Is it expensive to create a vaccine?
Wow, that is a very common question that we don't have the answer yet. There are many technologies and process, new technologies, and also the traditional ones that will have an investment, need a huge investment. But in this collaboration that I mentioned, there is a solidarity process as well, and then they are investing resources in order to develop technologies, and that will subsidize the prices as well. But we don't know the price yet. It's too early to have that answer yet.
And you mentioned that that of course, you know, we have the pooling mechanism, which is the revolving fund in Latin America and the Caribbean, and we have countries that are committed to ensuring that the most vulnerable groups, the people that need it most, will be the priority for having the vaccine once it's been developed. But taking, for example, the flu vaccine here in the United States, you know, I can go into a chemist and just pay for it and have it done privately. Do we know if that sort of thing will be the case for the COVID-19 vaccine? Will someone be able to, you know, pay for a dose privately in Latin America?
could be, but especially as it's a public good and the governments are going to invest in the vaccine, they will put it as a public good and then will be free of charge in the health system, in the official health system. But it could happen that the private sector also offer the vaccine, at least not at the beginning, because I guess that the vaccine will be managed by the governments. But later on, the private sector will be able to put vaccines in pharmacies. I assume that.
Right. But I guess most of all, it's the most important that it's available free of charge in the public health system. Let's reiterate that. That's the most important.
One of the characteristics of the immunization program in the region, having the vaccines free of charge for everybody, independent of the status of the person. They have access in any health center that they want to go for the vaccine. They will receive it free of charge.
So, but actually, also at the national level, our country, they have what we call the National Immunization Technical Advisory Group that for sure will provide a recommendation to the government and to the Minister of Health, to the President, on how to best coordinate and make this vaccine available for the private sector once it's available. So for sure there is going to be a lot of discussion, a lot of coordination as we have at the regional level, global level, also at the local level, to make sure that the vaccine is also available to all the sectors.
Brilliant. Thank you so much. So I have a couple more final questions because we're getting to the end of the session of Ask the Experts. But I'm going to say you have about 5 minutes, anyone that wants to ask a question from the audience before we'll have to call it a day. So I guess my two final questions, the first is, what do you think are the most important things that the general public need to take into consideration about a future COVID-19 vaccine?
I could say that as soon as the vaccine is available and offered through the Ministry of Health, the key message that people need to receive is the vaccine is available and is free, is safe vaccine and is efficacious vaccine. That was, if they are offering the vaccine because all the protocols were met in order to offer a good vaccine. Now, as soon as you have the vaccine, you need to demand to go to the health center to receive the vaccine. It's important that everybody receive the vaccine, and you have a personal and individual responsibility, not only to protect yourself, but protect your family and to protect your community. And that is a key message, that the only way that we wanna build herd immunity to protect the population is having more groups vaccinated. And then you have a personal and individual responsibility, starting with you, but also with the community and your family especially. And then the message is get vaccinated.
Thank you.
And from my side, I would say that you have to be sure, the public has to be sure that behind the vaccination, your vaccinator has been trained on injection safety, on the vaccine that is going to be administered. So there is a lot of preparation for this. So they have to trust the nurses, the vaccinator posts, as they have done it before when polio was eliminated, when measles was eliminated, when rubella was eliminated. This is the same, the nurses that is going to be providing the COVID vaccine is the same that have helped your families, and is going now to also help you providing the COVID vaccine. So we have to trust the service. We have to have confidence also in the vaccine.
Brilliant. So the COVID-19 vaccine, once it's been released, once it's in the hands of health systems throughout the Americas, will be safe, will be efficient, will be effective, and it will really be up to us to take the personal and also the community responsibility to make sure that we get vaccinated. And it's not just for COVID-19, it's for everything, which brings me to my second and final question, which is, what advice would you give to parents specifically who are worried about taking their children to get their routine vaccinations at the moment, given the pandemic, and might be tempted to consider waiting until after COVID-19 has hopefully passed?
I would say to parents, check your child's vaccination card. See if there is an appointment that you have failed, and make sure that you call your health facility that you used to go, or the healthcare worker that you used to contact, so your child is fully immunized. You have to be sure that the nurses are taking care of all the provision and all the measures to make sure that there is no contamination because of COVID. So hand washing, use of masks, and social distancing is being kept also at the vaccination post. So check your vaccination card and make sure that the child is immunized.
I could say that also be very well informed. The parents need to be very well informed, not only for the routine vaccination, but also the news about every vaccine. And then if they go to good sources, they will know that no vaccinating that child will be a risk for any vaccine preventable disease. And then she doesn't want to have a sick child when you have a preventive measure now. And then you see this COVID pandemic is a reminder of the importance of vaccination. I think that we need to take opportunity of this moment that we have, because everybody's waiting for a vaccine, but there are vaccines that we are not using or taking. And then that is the moment that we need to reflect right now, that we have tools that we need to use, that they are effective, that they are safe, and then we need to protect the population and close the gaps, because we started this program saying that there are gaps on vaccination coverage. And then this is the moment. And as Ana Elena mentioned, there are a lot of measures in order to ensure that vaccination activities are in a good, with protocols to be safe for the population and also for the healthcare workers. But the most important part is that we need to be vaccinated with all vaccines to be updated. And then that is the best way to be prepared for the new vaccine, just to close the gaps, to vaccinate it, and then wait for the new one.
So now is not the time to loosen our grip on routine vaccination whatsoever. We need to carry on protecting ourselves, protecting our children and families against these diseases, and make sure that we continue to access these vital healthcare services throughout the pandemic, and to trust that every measure is being taken to protect populations as well.
That's correct.
Thank you so much, Ana Elena and Alba Maria, for your time and for answering these questions. It's been hugely useful, and we will be back same time, same place next week for our next edition of Ask the Expert on a different aspect of the COVID-19 pandemic. Thank you very much. Bye-bye.
Thank you. Bye.
Thank you for having us.
Bye.